Hello students. So this PowerPoint will cover the extraoral exam. Some of the techniques that we'll be using when conducting the extraoral exam include inspection, looking at the patient using our eyes, palpation, using our fingertips and hands to move or compress structures against tissues, and auscultation, listening for sounds such as during the TMJ or temporomandibular joint movement. The methods that we'll be using include compressing soft tissues between fingers and thumb of the same hand, using the index finger intraorally and compressing tissues against fingers of the extraoral hand, using two fingers to compress tissue against underlying tissues, and using fingers to roll tissue from under chin over the inferior border of the mandible. This slide is a visual depiction of the methods that I just previously explained. Effective technique during the extraoral exam depends on consistent sequence every time, correct palpation technique, and careful documentation. So what are you looking for? Lumps, swelling, freely movable nodes, fixed nodules, asymmetry, wounds, bruises, or scars, tender areas, areas that are red, firm or hard consistency, irregular shaped lesions. So the extraoral exam initially begins in the reception area. Check the patient's gait, that's how they walk, the level of function of arms and legs, their level of anxiety. You may need to incorporate a stress reduction protocol. Is the patient having difficulty breathing? This could indicate a systemic disorder. Ask if they have a history of lesions. Do they have a history of skin cancer? Prior to examination, have patient remove eyeglasses. So you want to examine for a general appraisal of the facial form, skin, hair, eyes, and ears. Lymph nodes in health are usually undetectable. Node enlargement is an important sign of clinical disease. So lymph nodes play an important part in a body's defense against infection. Lymph nodes are assessed for tenderness or pain, swelling, enlargement, unusual hardness, or a fixed position. Swelling might occur even if the infection is trivial or not apparent. Swelling of lymph nodes generally results from localized or systemic infection, abscess formation, or malignancy. Palpable nodes usually indicate an increase in immune system activity. A palpable or feelable non-tender node may be the result of scar tissue from a past chronic infection. You may hear patients call their lymph nodes they have swollen glands. This image depicts lymphadenopathy due to an infection, and you can see the swelling right here. It's important to remember it's normal for lymph nodes to swell in response to any type of infection or immune system action. That's why they're there in the first place. The node will be firm, movable, warm, and tender. Sometimes the inflammation can spread to the overlying skin, causing the skin to appear red. So the lymph nodes of the head and neck that we'll be palpating during the extraoral exam include the occipital nodes. So you want to have your patient tilt their head forward. You'll work outward to the sternocleidomastoid muscle and palpate above in below the hairline using circular compressions. Postauricular nodes, and the auricle we learned last week was the ear, so postauricular are behind the ear. You're going to palpate in a circular motion, pressing against the bone. Be certain to peek behind the ear because this is a common site for squamous cell carcinoma. So you also want to make sure that you visually inspect behind the ear. The preauricular nodes are in front of the ear. You want to use circular bilateral palpation. Submental, mental meaning chin, sub meaning below. So these nodes are below the chin, and you'll use a digital palpation. Submandibular nodes below the mandible, you want to roll over the inferior border of the mandible and then down. Pushing the flesh to the side you're inspecting will allow you to roll the tissues up and down against the mandible. Palpating against the hard, immobile surface allows one to feel any irregularities. Anterior cervical nodes are located in front of the SCM. In order to palpate the anterior cervical nodes, as well as the sternocleidomastoid muscle, have the patient turn head away from the side you are palpating and in a downward direction. The superficial nodes are located along the external jugular vein. The deeper nodes are along the carotid artery, deep to the SCM. Use caution while palpating elderly patients. If you press too deep, you could occlude the artery and cause fainting. The posterior cervical nodes are located along the back or the posterior portion of the SCM. The supraclavicular, supra meaning above, clavicular meaning clavicle, are above our collarbone or our clavicle. You want to palpate one side at a time. Have the patient bring their shoulders up and forward. Be certain to palpate along the entire length of the clavicle to the sternum. The minimum nodes you should palpate during an extraoral exam are the superficial and deep nodes of the neck. And lymph nodes are best palpated using a bilateral circular compression. So next we'll look at our glands, the glands that make our saliva. First is our parotid gland. You want to use a bilateral circular compression from the tragus to the angle of the mandible. You want to note any pain, swelling, enlargement, or hardness. Next, you want to palpate the submandibular gland, also a salivary gland. First, you want to find the notch along the inferior border of the mandible. The submandibular gland is medial to this notch. Have patient bring their head towards their chest and tongue to the roof of their mouth, using a bilateral digital palpation for asymmetry, pain, swelling, unusual hardness, or difficulty swallowing. Next up is the thyroid gland, an important gland in our endocrine system. For this, you want to begin standing in front of the patient. Watch movement of the thyroid cartilage as the patient swallows some water. So have a cup of water ready. Then you will move behind the patient and you will palpate the thyroid gland slightly below the level of the thyroid cartilage. You want to displace the trachea to the side of palpation and tilt the head slightly towards the side you're working on. So the thyroid gland is located 2 to 3 centimeters inferior or below to the thyroid cartilage or Adam's apple. Here, the second image here is displaying the trachea being pushed to one side, to the side of palpation. So when palpating the left side of the thyroid, have the patient tilt their head slightly to the left. Displace the trachea slightly to the right. Use your right hand to position fingers between the SCM and the thyroid cartilage. Rest the fingers and have the patient swallow several times. Providing the patient with water will be helpful. Next, place fingers at the posterior SCM and have patient swallow to assess the distal portion or distal lobe of the thyroid. Note, a normal healthy thyroid gland is undetectable or barely detectable. So note any asymmetry, nodules, enlargement, or surgical removal. So many enlargements are not this obvious, so we need to visualize as well as palpate. So this kind of looks like that video we watched last week of the man from Flip or Flop with that very large swelling, and he had thyroid cancer, causing a goiter or an enlargement of his neck. Next is the larynx. You want to place the hand over the larynx, just right here, and have the patient swallow. The space between the SCM and the larynx should be the same. For the larynx, use a bimanual palpation to move it side to side to be certain its movement is unrestricted. Restricted movement of the larynx may be indicative of some pathology such as a tumor. Then we will examine the temporomandibular joint. You want to look at the patient as opening and closing the mouth for any deviations or limitations. Bilateral palpation from behind the patient with both index fingers placed anterior or in front of to the opening of the ear for any popping or crepitus. Grinding. Have patient protrude, stick their mandible forward, retrude, bring it back, and shift their mandible side to side. Then have the patient place 3 fingers in their mouth to assess any restrictions and opening. Be certain to note any pain, clicking, popping, grinding, or restrictions upon opening or closing. Any deviations may indicate TMD, temporomandibular joint dysfunction. And the muscles, the masseter and the temporalis. We will use bilateral circular compression. Pronounced masseter muscles are common in those who clench or grind. An enlarged masseter muscle may interfere with saliva production. So this is the masseter muscle located right here. When you have someone clench, you should be able to see the temporalis muscle move at the patient's temple. It's this large fan-shaped muscle here. So this is our temporalis. Bodybuilders often have a very well-developed temporalis muscle. The purpose of having the patient clench and palpating the muscles is to examine for any pain, swelling, enlargements, unusual hardness. The masseter muscle may feel a knot anterior to the angle of the mandible, which would indicate bruxism and or grinding habits. Patient may also experience discomfort inferior to the zygomatic arch, which is the cheekbone here, which also may indicate overuse. And the SCM, so in order to palpate the SCM, you want to have the patient turn their head away and in a downward direction. So we will use Dentrix to make notations up to lips for our extraoral exam. There is also a blue sheet that looks like this, located in our records room in the event we have a computer failure. A notation must be made for each area, such as WNL, which stands for within normal limits. Any blank space is assumed not observed. Documentation. Remember the ABCDs of documentation. Anatomic location. Be sure to document right or left. Example, the right commissure. And remember, it's the patient's right, not your right. The border. Is it regularly shaped? Is it irregular, poorly demarcated, or well demarcated? C, color change, configuration. Color and lesion pattern. Single lesion, multiple lesions. Is it red? Is it white? And D, diameter, dimension. If oblong or irregular in shape, length or width. If circular, diameter. Measurement of a line running from one side of a circle through the center to the other side is the definition of diameter. You want a thorough documentation in order to refer or for comparison at subsequent visits. This yellow sheet is located in each clinic, and it's used if a lesion or pathology has been observed and a referral is made to a general dentist or oral surgeon. Oftentimes, an intraoral photograph would be helpful in addition to the description noted on the previous slide.